So good afternoon, and thank you for visiting us, and thank you for visiting the most resilient city in the United States, my city. And so one of the first things we do at every presentation is be an ambassador, and there are several New Orleanians here, and so they are ambassadors as well. So ask us where to eat, where to go for art, where to go for fun, where to go when you're tired at 3 in the morning. We can tell you to go places, or my son actually can tell you much better. He's younger. As I give you a chance to digest this picture, the message to the left is what you normally see. The message to the right is what you don't normally see. I want to leave you and connect for you some of the messages you've heard this morning. The first is that the health of the ecosystem and that of its communities is inextricably linked. You cannot have one without the other. Message number 2 is that it takes a system, not individual people, to create resilience. Message number 3 is that the sum of individual resilience people does not make a resilient community, does not equal a resilient community. So take these 3 messages to your table as you're deliberating further. So is resilience really, does it look like this? Is this what resilient communities look like? Healthy kids playing in a clean environment? Is resilience survival? This is one of the post-Katrina or during Katrina pictures. I'll go very quickly because I know there is a very strict time checker here. Through some of the damages and some of what happens if you're not resilient, the first question that was asked this morning. So here are some of the costs along the Gulf Coast. So you see, we all suffered. The difference between natural disasters, sometimes called an act of God, and technological disasters have direct implications for resilient communities. First, the duration of the impact of a technological disaster is much longer. It is the unexpected nature of a technological disaster that sometimes differs or often differs from a natural disaster. You can at least watch that hurricane coming. There is the Weather Channel that tells you what's going on. With a technological disaster, you have no advance warning. There is no real low point because you don't know where that low point will be. Very specific for communities is the loss of control in a technological disaster. The effect is much longer, decades often, and there is greater disagreement within communities and among communities of how to deal with technological disasters. So here are some examples from our Gulf Coast. This is a community that has been fighting since 1951 to deal with hazardous waste sites. I mentioned this because earlier this morning, there was a question from one of the participants of how we will address environmental justice. This is the first site, and to my knowledge, the only site that made it to the national priorities list of our country by the Environmental Protection Agency because of environmental justice issues. I was fortunate or blessed enough to be part of that investigation in the mid-'80s. And so one of the main aspects, one of the main public health actions that we took was perform a public health assessment. And as you can read quicker than I can say it, you could see that we pretty much didn't find any immediate public health concerns, but yet the community had legitimate concerns about health problems, site cleanup, and contaminants from flooding. And so you could see the dissension between what you objectively perhaps find or what you scientifically find with what communities are truly experiencing. I'll take you, and I'm very pleased that one of our community leaders is in the room. I'll take you to another of my research projects where we have the voices of communities. So here are two voices. And you can read it, but the accent that I want to place is the difference between a natural disaster, hurricane as regular water, and the difference between that and a technological disaster, the Gulf of Mexico oil spill, oil-laced water. So what does it really look like for our communities? The second aspect goes to the notion of the interconnectedness between the ecosystem and people's system. So our beach life, our sea life, which is a protection against hurricanes, statement number one. But it is also our food. It is also this house for all of our foods. So I'm not sure when or how that can be repaired. So those are very powerful statements from communities, and these are fishermen on the coast. This is tough, and I wish you could see it better. It's the color of the slide, and I don't know how to fix that. But here are 6 cities that we have researched, and in those 6 cities, there were specific issues that they were dealing with. It's really a pity you can't see that. Let's see. Okay. But here is the summary of that slide. And you will recognize some of the issues that you've heard this morning. So the factors in communities that influence readiness and capability have to do with going back to what has become a very heated debate about should we create denser cities, the density of the pre-disaster population. The denser the pre-disaster population, the more resilient that community becomes. The levels of isolation versus proximity to large metropolitan areas. The closer you are to a large metropolitan area, the better you will do. The extent of the local infrastructure strength. Remember, I started with saying it's a system. It takes a system. But it takes that local infrastructure system. The more robust that system is, the better you will be able to recover, and the better you'll be able to be resilient. Same goes for the economy. Same goes for public transportation. Consistent access, not only to health services, but the quality of those health services. In the middle of the presentation, I will also give you some messages. So here is one of them. If we can successfully and effectively help the most vulnerable among us, then we can successfully help and make everybody resilient. So if we address the most vulnerable, we will be able to help everybody. At least you can see this. So one of the ways, and I'm taking you into tomorrow and thinking about now how could we become more resilient. So you've heard the ecosystem, and this morning you've heard some other ways to become more resilient. This is the community's way to become more resilient. And so if you look at these are 4 cities along the Gulf Coast, from Bayou La Batre, Plaquemines Parish, Biloxi, and New Orleans, and you look at what the needs are now several years out of Hurricane Katrina, but just after the oil spill, you could see it goes from cash flow in Bayou La Batre, Alabama, all the way to culture in New Orleans. And so you could see that communities become resilient and recover in different stages. One of the ways to make communities more resilient is to actually use the assets within communities themselves. One way to do that is to create what we call disaster navigators, often called community health workers or community interventionists. And I'm very pleased to have with us, and actually quite an honor for him to be here, one of those in the room, David Gauthier. Thank you, David. And so you could see we worked through a system of patient navigation, a well-researched phenomenon in healthcare, and made that a community-based disaster interventionist. Just quickly sharing with you current research that's going on along the Gulf, focusing on the ones that are most vulnerable, pregnant women, and looking at the link, what I call the disaster duo. The longer an environmental health event occurs, the higher you'll see mental health issues begin. And so that disaster duo is what we're currently evaluating. And so here are some influences of why people are more health desperate. disparate and why we need to address those vulnerable populations. And so, again, you can read faster than I can say it, but you see things from culturally competent providers all the way to education and environmental pollution. So unless we address each one of these, we will not really create sustainable and resilient communities. So everybody can cite what indicators of health are. I want to point out that policy making is very much an indicator of health, as it is access to healthcare or individual behavior or even our own genetic makeup. So what if we wanted, I'm out of time, I'm just going to do this very quickly. What if we really wanted to create resilient communities just looking at clean air and water? We would have to involve both public health, and I was pleased to see that was the #1 way to become more resilient, but also industry. We'd have to look at ecosystem and environmental policies, policymakers and community capacity building, and vulnerable populations and boosting their economy. And so when we talk about communities, it's not only where people live, but it's what their assets are, how they link together. We've heard about, there was a question earlier about social organization, and what their values and controls are, social and customs. And so it's about resilience truly is in the middle. You can't see it projected. It's about bridging social capital rather than bonding social capital. So I want to leave you with 3 questions for dialogue. What characteristics must a resilient community have in order to bounce back? What must the community do day to day? As I told somebody in the restroom, it's about brushing your teeth to become resilient before a disaster occurred. And what efforts at forecasting must resilient communities make? There is no time for you to dissect this picture, but this was a picture from a child of one of my staff who drew this on our blackboard at the university after Hurricane Katrina, and you could look at the messages that sends. So thank you.